Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for hemicrania or migraine. Both the term meaning same. We will use hemicrania term throughout. What is hemicrania? Hemicrania or migraine is a type of primary chronic continuous or paroxysmal one-sided pain in head or face. Women are more affected compared to men. What is the characteristic of hemicrania? Pains run relentlessly, months after months, years after years, sometimes with break. Pain ranges from mild to medium, time to time over baseline pains, extra intensity added. It affects a particular side of head with aggravation and amelioration. No background malady is generally found. Occasionally, autonomic sign symptoms, reddening of eyes of affected side, tearing, drooping of eyelids, running of nose, clogging are there, nausea, vomiting, intolerance to light, sound, pulsating pains. Just relevant pictures have been, some of the relevant pictures have been shown. What are reasons of hemicrania? No definite reason is still known, but following factors aggravate the problem. A. Mental tension. B. Intense light. C. Tiredness. C. Excessive physical activity. E. Alcohol. C. Change in sleep hours. What are the signs and symptoms of hemicrania? A. Throbbing pain in eye or adjoining part of head. B. Nausea, vomiting. C. Runny nose, sinusitis. D. Red eyes with tearing. E. Drooping of eyelids. F. Nasal congestion. G. Sensitivity to light, noise, etc. What are the predisposing factors of hemicrania? Number 1. Adult female, more affected. Drinking much alcohol, coffee, chocolate, cheese. Excessive physical exercises. Change in temperature, stress, sun heat. What are the types of hemicrania? Hemicrania are of two types. Which is a two type? Number 1. Hemicrania continua. That is continuous hemicrania. Persistent headache that rarely go. Number 2. Paroxysmal hemicrania. That is part repeated attack, causes repeated sudden attacks. How can hemicrania be prevented? Number 1. Avoid all addictions, chocolates, cheese. Number 2. Too much exposure to sun. That is, you have to avoid this. Avoid too much of physical exertion. Avoid stress. Practice 15-minute brisk walking so that a few drops of sweat come out. Try to avoid OTC drug as far as possible. Avoid all sorts of canned, bottled, tinned and packet foods and drinks. Ensure 7 to 8 hours of sound sleep. Now note that there are a few items are asterisk. Item number 5, practice 15 minutes of brisk walking, double star. That is, this, if you practice this, your stress, number 4, and your sleep will be, avoidance of stress and ensure of sleep will be automatically achieved. This is the most important thing. So practice 15 minutes of brisk walking. It is not too much physical exercise, but it is a very important thing so that a few drops of sweat comes out. That's all. Now remedies. Calcium for hemicrania. Very much adapted to weak, anemic person, teenaged boys, girls, and if hemicrania intensifies during new moon or full moon. If the malady arises out of indignation or failure in love or excessive sex or loss of vital fluid, this remedy gives a sure success. Troubles decrease during summer when lying down, increase in winter on mental exertion, subjects restless and like to wander around. Spigelia for hemicrania. Pains from left occiput to left eye. Burning, jerking, stitching, tearing like pricking of hot needles. Worse when stooping, jerking, vertigo. When looking down, standing, walking, must always look straight ahead. Left-sided supraorbital neuralgia. Subjects afraid of pointed things like pins and needles. Califos for hemicrania. If the reasons of trouble is nervous excitation or paralysis, caliphos is infallible. Tongue covered with yellow-brown coating of stale mustard paste. Subjects all discharges from body like urine, sweat, etc. intensely foul. They have history of excessive masturbation, sexual activities. Feel better from mental mirth, being amongst others. Feel worse in morning from fast and excessive body movement. Better during sleep, eating and slow movement. The underlying symptoms are subject's own symptom, physical symptoms or total symptoms, his personal symptoms, and these are his disease symptoms. Argentum nitricum for hemicrania, boring pain in head, worse in left frontal eminence. Left frontal eminence, better by tight bandaging caused by mental emotion. Bones of head feel as if separating. Head feels as if large, frequently ending in vomiting of bile and sour vomiting. Subjects hurried, impulsive, timid, anxious, hesitate, falter in speech, impulse to jump when passing a bridge or out of windows. Think time passes too slowly. Belladonna for hemicrania. Right-sided hemicrania, attack comes suddenly, face red, hot, burning, dry, with throbbing of carotids. Throbbing of carotids is compulsory, key symptoms of belladonna. Pupils dilated, same thing. Eyelids, mainly right, sore, swollen. Appear smaller, headache, hammering. Warts on temples, on motion, tongue, red, hot, swollen. Subjects delirious, restless, fearful. Weep easily, moan constantly, worse from sun, washing head, light, noise, jarring, touch, pressure. Better from bending backward, turning on affected part. Causticum for hemicrania. Hemicranic pain with nausea and vomiting in the morning. Worse motion of head, walking, increasing progressively with time and then suddenly diminishing. Constant succession of jerks or shocks felt in head. Subjects oversympathetic, feel better in wet damp weather, worse in clear fine weather. Can pass stools better while standing. Netamur for hemicrania. Dull, heavy headache with drowsiness and profuse tears. Attack in the morning in bed. Decreases after rising and moderate exercise. Gets worse from rapid motion with nausea and vomiting of water like flame. Pain as if head would burst. Worse from coughing, left-sided affections. Subject feel worse during 10 to 11 am but relieved by perspiration. They have mapped tongue with red insular patches. Consolation makes their trouble worse. Intense craving for salt, bitter things, fish, milk, aversion to bread, coffee and tobacco. On the left hand side bottom, a picture of this map tongue has been shown. Netamsal hemicrania. Boring pain in right temple preceded by burning in stomach with bitter taste. Menstrual migraine. Attacks recurring every spring with sudden onset. Heat in vertex as if it would burst. Vomiting worse from motion and reading. Better by keeping subject quiet. Subjects become sad from music. Have burning thirst for cold water. Mainly in evening. Feel worse in damp, rainy weather. Sternum or sternum metallicum, that is for hemicrania. Neuralgic headache every morning over one or the other eye, mainly left, gradually spreading over whole forehead. Vomiting of biles and mucus. Morning pain increasing then decreasing. Painful jerks through left temple, forehead, leaving a dull pressure. Worse from rest, better from motion. Subjects very sad, despondent, disinclined to talk. Feel like weeping all the time. Feel weak and fainting when going downwards. This symptom is also available in borax and chamomilla. This is a very rare symptom, mind it. Feel weak, fainting when going downwards. Generally, when patients go upwards, they feel weak, fainting. But this sternum is reverse. Theridion for hemicrania. Flickering before eyes, nausea worse by closing eyes and by noise. Hypersensitivity of acoustic nerve. Hypersensitive acoustic nerve, that is the listening capabilities is hypersensitive. Throbbing over left eye and across forehead. Desire for stimulant. With this, the video ends. Thanks for listening and viewing. If there is any problem, please write down in the comment section. I will certainly respond.